Hello students, today we are going to learn about palate. The term palate refers to the roof of the mouth. So here is a schematic sagittal view of head and neck region where we can appreciate palate, which is like a partition between nasal and oral cavities. And the palate consists of two parts, hard palate and soft palate. Hard palate which forms anterior 4/5 of the palate and soft palate which forms the posterior 1/5 of the palate. So, the hard palate is the partition between the nasal and oral cavities. Its anterior 2/3 is formed by the palatine process of maxillae and posterior 1/3 by the horizontal plates of palatine bone. So, till here it is formed by the palatine process of right and left maxillae, and posterior part is formed by the palatine shelves. These are from the palatine bones, horizontal plates of palatine bones. So here is the inferior surface of skull or base of the skull showing the hard palate. So these two are the palatine process of right and left maxillae, which makes anterior 2/3 of the hard palate, and posterior 1/3 is formed by the palatine horizontal plates of palatine bone. And anterolaterally we can see here the hard palate becomes continuous with the alveolar arches and gums. The posterior margin of the hard palate is free and provides attachment to the soft palate. Inferior surface of the hard palate presents features like incisive fossa, which is a small pit anteriorly in the midline behind the incisor teeth, and into which the openings of incisive canals are located, and each incisive canal or a foramen is right and left pierces the corresponding site and ascend into the corresponding nasal cavity, and incisive foramen transmits the terminal part of nasopalatine nerves and greater palatine vessels. So here is the incisive fossa. Where right and left incisive canals are located. And through the incisive canals, terminal parts of nasopalatine nerve and greater palatine vessels will pass through. Next, the greater palatine foramen on one on each side is located. So, these large foramens here and here. And greater palatine foramen which is present on either side of the hard palate, it transmits greater palatine nerves and vessels. Lesser palatine foramina, they are usually 1 to 3 in number on each side and are in the pyramidal process of the palatine bone. So here is the pyramidal process. So lesser palatine foramina are usually located over the pyramidal process, usually 2 or 3 in number. and they transmit lesser palatine nerves and vessels. So, they provide passage to lesser palatine nerve and vessels. And posterior nasal spine is a conical projection in the median plane on sharp free border of posterior border of hard palate. So, here is the posterior nasal spine. Then palatine crust is a curved ridge near the posterior border of the hard palate, and masticatory mucosa is the mucosa membrane lining the hard palate, and in the anterior part it is firmly united with the periosteum of multiple fibrous strands which are called as Sharpie's fibers. Hence, moving bolus of the foot does not display the mucous membrane. These curved arches are the palatine crust. Palatine crust are the curved ridges which are present near the posterior border of the hard palate, and the masticatory mucosa is the mucous membrane lining the hard palate, and in the anterior part it is firmly united with the periosteum of the hard palate by fibers called as multiple fibrous strands which are called as Sharpie's fibers. Hence, moving foot or the bolus does not displace the mucous membrane. So, the hard palate exhibits the transverse masticatory ridges which are transverse ridges present on either side of midline. Palatine raphe is a narrow ridge of mucous membrane extending antero-posteriorly in the midline from a little papilla overlying the incisive fossa. So, from the midline from here it extends, and this whole hard palate, if you see, it is lined by stratified squamous non-keratinized epithelium. So, the mucous membrane is stratified squamous non-keratinized epithelium. Arterial supply. The arterial supply to the hard palate is by greater palatine arteries from the third part of maxillary artery. So, we can see the greater palatine artery which is exiting out through the greater palatine foramen. And greater palatine arteries, they are the branches of the third part of maxillary artery. Each artery emerges from the greater palatine foramen and passes forwards around the palate lateral to the nerve to enter the incisive canal and pass upwards into the nose. So, here we can see it is enter into the incisive canal, into the incisive fossa. Venous drainage. The veins of the hard palates drain into pterygoid venous plexus mainly and also drains into pharyngeal venous plexus. So, we can see the greater palatine veins which are along with the greater palatine artery. And these veins finally drain into pterygoid venous plexus and pharyngeal venous plexus. Nerve supply of hard palate. It is supplied by greater palatine and nasopalatine nerves which are derived from pterygopalatine ganglion. So, here is the lateral view of nasal cavity along with the palate. So, we can see here this is the pterygopalatine ganglion. So, the descending branches are the greater palatine nerves and also nasopalatine nerves. So, these nerves are derived from the pterygopalatine ganglion. Greater palatine nerve supplies the whole of the palate except the anterior part of hard palate behind the incisor teeth. So, just behind the incisor teeth where the area of premaxilla is present, only that part it is supplied by nasopalatine nerves. Lymphatic drainage of hard palate. the lymphatics from the palate drain mostly into upper deep cervical lymph nodes and few into retropharyngeal group of lymph nodes. Next, moving on to soft palate. Soft palate is a mobile muscular flap which overhangs down from the posterior border of the hard palate into pharyngeal cavity like a curtain or a vellum. It separates the nasopharynx from oropharynx. So, here we can see soft palate. This is the hard palate. So, we can see the soft palate overhanging like a curtain or like a vellum into the oral cavity. It separates the nasopharynx from oropharynx. So, here is the oropharynx. And the pharynx behind the nasal cavity is the nasopharynx. So, external features of the soft palate presents anterior surface which is concave. So, this is the anterior surface, I am writing A over here, anterior surface which is concave and it is marked by a median raphe. Posterior surface is convex and continuous with the floor of the nasal cavity. So, the dorsal surface is the posterior surface, I am writing P over here. And superior border is attached to the posterior border of the hard palate. So, here is the superior border which is continuous with the posterior border of hard palate, and inferior border is free and it forms an anterior boundary of pharyngeal isthmus, that is the connection between naso and oropharynx is called pharyngeal isthmus. So, inferior border is free border which forms a boundary of oropharyngeal isthmus, and it is like a small conical projection which appears to be like a small tongue-like projection hanging down from its middle of the oral cavity called as uvula. So, we can see the inferior border which is in the midline forms a tongue-like projection, small conical projection which is called as uvula. And on each side forms the base of the uvula. Two curved folds of mucous membrane extends laterally and downwards. So, you can see the two mucosal foldings. This is the anterior fold and the one which is behind is the posterior fold. So, in the sagittal view we can appreciate still more better. Here is the anterior fold and this is the posterior fold. So, the anterior fold of the mucous membrane which is at the junction of oral and pharyngeal parts of the tongue. So, this is the oral part of the tongue and this is the pharyngeal part of the tongue. So, it is the junction between the oral and pharyngeal parts of the tongue called as palatoglossal fold. So, it is between the palate and the tongue, so it is called as palatoglossal fold. Posterior fold merges with the inferiorly with the lateral wall of pharynx. So, this is the posterior fold which is called palatopharyngeal fold, and it merges with the lateral wall of the pharynx. So, the palatopharyngeal fold contains a muscle called palatopharyngeus muscle which forms the posterior boundary of tonsillar fossa. So, we can appreciate palatine tonsil here. So, anterior to the palatine tonsil is the palatoglossal fold, posterior to the palatine tonsil or tonsillar fossa is the posterior that is palatopharyngeal fold. So, let us understand the structure of soft palate. The soft palate is a fold of mucous membrane enclosing 5 pairs of muscles which are skeletal muscles. The upper surface of the soft palate, which is a part of respiratory tract, it is lined by pseudostratified ciliated columnar epithelium. So, here we can see pseudostratified ciliated columnar epithelium. And we can appreciate the nuclei at different levels, and we can see the cilia from its upper border. So, it is a respiratory epithelium, which is the pseudostratified ciliated columnar epithelium, the part that abuts on the passavant ridge or posterior pharyngeal wall, which is lined by non-keratinized stratified squamous epithelium. So, here we can see non-stratified squamous keratinized epithelium. The oral surface of the soft palate, it is lined by non-keratinized stratified squamous epithelium. The submucosa of both the surfaces, that is oral surface and nasal surface, which are plenty around the uvula, that mucous glands are plenty around the uvula and on the oral aspect of the soft palate. The mucosa on the oral surface of the soft palate also contains some taste buds, especially in children, and also contains some lymphoid follicles. Now, let us understand the muscles of soft palate. We know there are 5 pairs of muscles: tensor palati or tensor veli palatini muscle. Next is the levator palatini muscle. So, let us understand these muscles in the sagittal view. The previous image was along the inferior aspect. So, here we can see this is the auditory tube. So, here is the levator veli palatini. Palatoglossus muscle, palatopharyngeus, and musculus uvula. And there is one more muscle called as tensor veli palatine muscle, which I had shown in the previous image. All the muscles of the soft palate are extrinsic except the musculus uvula, which is intrinsic. So, the origin, insertion and the actions of the muscles are like starting with the tensor palatine muscle. It is a thin triangular muscle, and where it gains its origin from the cartilaginous part of auditory tube. So, here we can see tensor palatine muscle gaining its origin from the auditory tube, and also from the adjoining part of greater wing of sphenoid. So, we can appreciate greater wing of sphenoid here. So, after its origin, the muscle descends, converges to form a tendon which hooks around the pterygoid hamulus. So, here this is the pterygoid hamulus. And we can see the tendon winds round the pterygoid hamulus. So, after winding round, then it expands to form a palatine aponeurosis for its attachment. So, this is the image where the hard palate, the muscles of the soft palate are exposed, and we can see the oropharyngeal isthmus here. So it is taken in a cross section in the base of the skull at the level of oropharyngeal isthmus. So the actions of tensor veli palatini tightens the soft palate and it helps in the opening of auditory tube. Next, about the levator veli palatini muscle. Levator veli palatini, it gains its origin from the medial aspect of the cartilaginous end of auditory tube and also from the adjoining part of petrous part of temporal bone. So this is the petrous part of temporal bone. And here is the levator veli palatini muscle. And the muscle runs downwards medially and spreads out into to get inserted into palatine aponeurosis. So we can see the muscle is spreading along with the palatine aponeurosis and getting inserted into the soft palate. So as the name suggests, levator palatine means it helps in the elevation of soft palate and closes the pharyngeal isthmus and helps the opening of auditory tube. So it closes the pharyngeal isthmus during deglutition. Next, about the musculus uvulae. Musculus uvulae, we know it is an intrinsic muscle. It is a longitudinal muscular strip, one on the either side of the median plane within the palatine aponeurosis. So it gains its origin from the posterior nasal spine and palatine aponeurosis. So here we can see palatine aponeurosis and posterior nasal spine projection, which provides origin to musculus uvulae, and muscle inserts into the mucous membrane of uvulae. So the muscle inserts into this mucous membrane of uvula, and uvula pulls forward and on its own side. So action of the uvula is to pull the uvula forward on its own side. Next, about the palatoglossus and palatopharyngeus muscle. Palatoglossous, it is present on the oral surface of palatine aponeurosis. So it gains its origin from the oral surface of the palatine aponeurosis. It descends down in the palatoglossal arch and it is inserted on the side of the tongue at the junction of its oral and pharyngeal parts. So this is the oral part and this is the pharyngeal part. Here it gets inserted. This is palatoglossus muscle. And action of palatoglossus, it pulls the root of the tongue and approximates the palatoglossal arch and closes the oropharyngeal isthmus. So it pulls the tongue, elevates the tongue upwards, closing the oropharyngeal isthmus. Next, about the palatopharyngeus muscle, consists of two fasciculae which are separated by levator palati muscle. So this is palatopharyngeus, and palatopharyngeus, it gains its origin from it has two fasciculus, I said. So anterior fasciculus gains its origin from the hard palate, posterior border of the hard palate. So here is the anterior fasciculus which is gaining from the posterior part of hard palate, and posterior fasciculus from the palatine aponeurosis. So this is the posterior fasciculus from the palatine aponeurosis, and both merge to form palatopharyngeal arch, which is inserted into the medial wall raphe of the pharynx. So they get inserted into they form the median raphe of pharynx, pharyngeal wall, they get inserted. And action of palatopharyngeus, it raises the walls and larynx during swallowing. So let us understand the functions of soft palate on the whole. It separates the oropharynx from nasopharynx during swallowing, or that food does not enter into the nose, and it isolates the oral cavity from the oropharynx during chewing so that the breathing is not affected, and it helps to modify the quality of voice by varying the degree of closure of pharyngeal isthmus, and protects the damage of nasal mucosa during sneezing by appropriately dividing and directing the blast of air through both nasal and oral cavities, and prevents the entry of sputum into the nose during coughing by directing it into the oral cavity. So these are the functions of soft palate and the muscles of soft palate. So here we can understand again, this is levator veli palatine and this is palatopharyngeus, and here is the palatoglossus, and we can see the uvula overhanging. Clinical correlation: paralysis of soft palate. The paralysis of muscles of the soft palate due to the lesion of vagus nerve produces nasal regurgitation of fluids or nasal twang in the voice, flattening of palatal arch on the side of lesion, and deviation of uvula to the opposite side of lesion. So we can see the uvula is deviated here. So uvula is deviated to the opposite side of lesion. So the lesion is on this side, and this side is the normal side. So because of the pull of normal muscle, it gets deviated to the normal side. So these are about the paralysis of soft palate and lesion to the vagus nerve. Blood supply of soft palate. Arterial supply is supplied by lesser palatine branches of maxillary artery. So and also the palatine branches of ascending pharyngeal artery and ascending palatine branch of facial artery. So here we can see lesser palatine branches. And we can see the ascending pharyngeal artery as well. And also it is supplied by palatine branches of ascending palatine artery, which is a branch of facial artery. Venous drainage. The venous blood from the palate is drained into pharyngeal plexus and pterygoid venous plexus. So we can see the veins here which drains into pharyngeal plexus and pterygoid venous plexus. Lymphatic drainage of the soft palate. It is similar to that of hard palate, where it drains into retropharyngeal group of lymph nodes. So here we can see posterior to the pharynx, retropharyngeal group of lymph nodes in this second image. And also they drain into upper deep cervical lymph nodes. Nerve supply. Motor supply. All the muscles of soft palate are supplied by cranial root of accessory nerve via pharyngeal plexus, except tensor palatine muscle, which is supplied by nerve to medial pterygoid, which is again a branch of mandibular nerve. So except tensor palatine. So tensor palatine alone is supplied by branch of mandibular nerve. Rest of all the muscles of the soft palate, they are all supplied by cranial root of accessory nerve. Sensory supply. General sensations from the palate are carried by lesser palatine nerves of maxillary division of trigeminal nerve, and also the via pterygopalatine ganglion. So lesser palatine nerves, they are the branches of maxillary division. Via the pterygopalatine ganglion, they supply the soft palate, and also the sensory supply is by glossopharyngeal nerve, 9th cranial nerve. Let us understand about the Gag's reflex. The Gag reflex is a protective reflex characterized by the elevation of palate, that is the soft palate, and the contraction of pharyngeal muscles with the associated retching and gagging in response to the stimuli of mucous membrane of oropharynx. It occurs when the palate, tonsil, posterior part of the tongue or posterior pharyngeal wall are touched by unfamiliar objects such as swab or spatula, etc. So the efferent limb of the reflex is provided by glossopharyngeal nerve and efferent limb is by vagus nerve. So that is about Gag reflex. So this completes the clinical aspects and the normal anatomy of hard palate and soft palate. Thank you.